I am excited to move right into our second panel, which is going to be considering inequities from the direct service perspective. We are excited to have Dr. Bernadine Futrell, Director of the Office of Head Start, moderating this next panel, and I will hand it over to her and let her take it away. Thank you, Dr. Futrell.
Thank you so much, Catherine, and hello, everyone, and welcome back after the break. I know there have been robust conversations this morning about moving forward some very significant work, and so I thank you very much for your partnership and being a part of this conversation on today. As shared, I'm Dr. Futrell. I am the proud director of the Office of Head Start. I'm also a proud alumni of the Head Start program, and what I share often is when I joined Head Start, my family came to Head Start. And so we came to be connected with resources and support in ways that have changed my life and the lives of many, many others because of that impact. And so I'm very honored to be an alumni and also a former Head Start assistant teacher. So today's conversation is around looking at inequities from a direct service level, but looking at the lens for data and research. And I welcomed rather this opportunity to moderate this panel with some great leaders because I understand that data can really help make great decisions. And then sometimes it can also help make decisions that aren't so great, right? And so when we start talking about data and research and looking at them as tools, right? So the conversation is important because data and research are tools that are useful for us to make good decisions. But they are also things that can unpack for us inequities that we can address, or they can suppress for us inequities that we may not see. And so the blind spots can be created with data when you don't have an equity lens or you don't center the data around equity regarding data collection and the information we use. When I say center around equity, what I mean is looking for inequities in the data collection, the methodology, the decisions you're making off of it, even down to the psychometric properties of what the data is showing you back. Is it reliable and valid for particular populations, or is it something different happening there? And so addressing data through an equity perspective and centering equity in the data is about looking through that lens where you're trying to unpack and figure out what's to your left and what's to your right that you may be missing. While we know very clearly and very confidently, because research methods gives us this confidence to look right in front of us, but equity and the work of disrupting inequities is about looking to your right and looking to your left. And we come together for this conversation because we know that historically marginalized groups of people who are showing up in places and the data is telling a different story. I like to think about equity and data from like a psychometric perspective, a very clear sentence. Data equity is ensuring that both the story you tell from the data and the decisions you make from the data are inclusive in bringing people along with you along the road towards the goals that you have. Because we know we like to collect stories, especially in human services. But what decisions are we making from those stories, and how are we telling those stories in a way that are empowering those who are a part of the many solutions that we're proposing? And I'm very thoughtful about that as we think about the great work for Head Start. So as I mentioned, today's conversation is around inequities in data collection, data integration, and just the larger research process for historically marginalized groups in the United States. And we have some wonderful leaders who are going to join here. And just to put a framework on it, thinking about data collection, what are the unintended consequences that the participant feels when we're collecting data? How are we defining groups? Do we have any humans who are subgroups? And how are we interpreting the data? Again, what's the difference between the stories we tell and the decisions we make with the data? So again, today's conversation, I'm going to welcome three panelists to talk with us today, but I just want to leave with you just in case you ever want to check in on equity in your data or apply an equity lens to your data collection. Consider this activity. If you were to walk in a room and asked everyone who had a particular color shoe on to stand up, and those who didn't, not to stand up. Imagine yourself not having the color of shoe that's being asked to stand up. Feel that as a participant in data, and then use that to drive every decision you make around data collection and every decision that we will make around data collection to really move forward the agenda ahead. I'm proud of the work that we do at the Office of Head Start, but I know there's work that we can do to be more inclusive and supportive in our data. And with that, I am proud to welcome our panelists who are going to share some experiences and some content from their from the work that they do. So we have today joining Drayton Jackson, who's from Dismantle Poverty in Washington. He's going to talk about racial and ethnic inequities. We also have the topic of inequities by ability by Maria Martinez from Pueblo Brain Injury. And then inequities based on gender identity and sexual orientation by Terra Russell-Slavin from the Los Angeles LGBT Center. With that, I want to welcome Drayton. Thank you.
Oh, Drayton, you're muted.
Always doing that. So, okay, all right, good, because it's still up there. So I was trying to think about today and how to, just come to everybody and make sure that I just don't bring the same and the normal things that, everybody else does. Because that data, when we talk about research and we talk about everything for Black people, is very scary. I'll say it in that term. A lot of times we're not at the table dealing with it and being put into the position of asking the question. My recent work now with the Urban Institute kind of brought that up with, we had researchers there that, they allowed our lived experience to come to the table. And let's just say this, a lot of the researchers were shocked over things that they didn't think about in their research. And what we found was people with lived experience and voices and people that are in the systems need to be a part of the research team to ask the right questions. And I think what we're not doing in the collection of data, especially with people, marginalized people or people of color, is we're usually not the ones that get the money from the other side or be in charge of directing the research. So for me, it's making sure that we collect and put people, doesn't have to be the degree, doesn't have to be anything fancy, but people like myself that just have lived through it and ask researchers and challenge the data that you see and make sure that it's right. Is the right question being asked? And that's what we're finding out in a lot. Head Start, and I agree with you, Dr. Futrell. Head Start changed my life, for the better. The person you see right now sitting in front of you is because of Head Start here in Washington State. But it was the first time that, I ever got asked the question after they asked my son, what does he want to do, was what was your goals? And as a Black man in America, that was a critical part of me just believing that I mattered and I existed. So, to know that I'm there and somebody is looking at me, that came from some thought to say, hey, why are we not looking at this from two generational? Why are we not looking at this from a perspective of understanding? So let me know if you want me to keep going on, I can stop. So the key part that you find with what I always find and what we did with the poverty reduction work group was that lived experience trumps everything. So what I went through in my life, I never knew I had a story. I never knew that anything that I have ever did was mattered. So, you're looking at a person that my mother was about 300 pounds, almost 6 feet, Black woman, that if Head Start kneecap was in her life, I believe she would have got the help that she needed. But when we look at what society says and we look at what data said at that time of growing up, you know, she was a woman that was taking advantage of the system. She wanted to be lazy. I literally at 7 years old heard a Black caseworker tell my mother that you're just a Black, fat, lazy woman that just doesn't want to work. That's what you want to sit home and do nothing. And that stuck with me because I already viewed my mother, I was already embarrassed with my mother, right? But that kind of stuck to it. And this is the caseworker that my mother came to for help. But it wasn't until years later, after my mother passed away when I was 11 and I turned 17, that I realized my mother had a PhD. My mother held down a great job, but whatever happened was the reason that put us in the projects and put us down this road. And now, you know, back then we didn't talk about, especially in the Black community, we didn't talk about depression. We didn't talk about mental illness. And that's what my mother was suffering from. And put on that identity crisis of her being this big Black woman that people laughed at when she walked. So, you know, we have to understand, you know, just the basis of what are we trying to collect and what do we need to collect it for. So when caseworkers and you know, organizations like DHSH, TANF and all of the, that's what drives a lot of what quote unquote they go off of, right? So when we say, oh, you know, we got, oh, this data shows this and this data shows this, but what we don't look at is the effectiveness of the programs that are really being put into place. Because we'll take the data and then we'll think that it applies. And a lot of times it doesn't apply. So we have to not only change our mindset on how we look at data, we not only have to change our mindset on what are we using data for, we have to change our mindset on, does it connect? Is it in real time? Does data have the connectivity to show that this isn't really working? What I found, and my foundation is doing a lot of work, and got to put a plug in, Foundation for Homeless and Poverty Management. What we found during our pandemic, well, the pandemic, sorry, was there was a lot of adults that did not know how to read. You know, and when we looked for data on it, there was really no real census of why, you know, or that data on adults that did not know how to read. But this is what we don't understand. Connect that person that does not know how to read to filling out an application to get help. And that part is where the disconnect, I believe, is when you come at, oh, well, you know, our roles dropped on TANF. Yeah, but how many of their roles in data do those people do not know how to read or understand the application? And that's where we, you know, looked at it from a perspective of changing things and looking at the overall of, is data connecting and are services really connecting with people to change their life? Or are there just services that offer? And I think that that's something that, you know, I'm diving into more and more that we do work. So for me, it's making sure that we don't do things the same, but making sure that people with lived experiences are at the table.
Thank you so much. Wonderful. And I'm looking forward to engaging in a Q&A a little later. And let's welcome our next panelist, who will kind of help along the lines of talking about, from a direct service perspective, like how do you address inequity and equity in the work that we do? And you did a great job talking about the decisions that are being made. Now let's talk a little bit. I'm going to welcome Maria to join us to continue the conversation around access and support from direct service providers. Maria?
Hi, thank you for allowing me to speak today. I'm an individual with a brain injury from a motorcycle accident and stroke. And I am an advocate for brain injured people in Pueblo, Colorado, which is closer to the New Mexico border. And what I focus on is advocating to educate and strengthen survivors to support each other as peers. And I want the awareness to be spread throughout the region of Southern Colorado, and as well as being a person that wants to support other brain injury communities within Colorado. Pueblo brain injury, I was a support group leader that worked with other individuals in our community that had brain injuries. And whether it be a traumatic brain injury or acquired brain injury, we need to meet the needs of everybody that is affected by the impact of brain injury. For my part, I tried to bring in support groups that will offer activities that will help us with cognitive, tactile, and visual impairments. And we work with various things like creative writing and arts and crafts and brain chat. And brain chat is probably one of our most successful because it allows all the survivors of brain injury to be able to share what's going on in their worlds. You know, how are they being limited from access of different types of situations that impact their lives on a daily basis. Next slide, please. Rural communities' barriers to service access. Pueblo, Colorado our county is about 168,000. And within that county, we have 7 other entities that the populations can run from 200 to 33,000. And the biggest impact for the rural is the programs are very far away from Pueblo or even from the metropolitan of Denver, Colorado. It causes a lot of hardship and cost to be able to go someplace where you need to get care. The lack of computer and internet availability, for some people, broadband is very minimal. And a lot of people that live in rural situations may have a computer but not have the access to the internet. And that pulls them away from being able to obtain care through portals like our hospitals that give us the opportunity to enter a portal and set appointments. Some people can't even receive med care, telemed through that. The support services that are focused on the city is a priority. The further out you are in rural Pueblo County, the less you have as far as obtaining services. And for people to be able to travel to Denver to obtain services, it's an all-day situation. It takes away from people that work, the caregiver, et cetera, and they have to take a day off and they have to take their loved one to an area like Colorado Springs or Denver. The not enough service providers, especially those who are culturally competent, we lack that very much in Pueblo, Colorado. We need more people that, providers that work in the hospital situation, like our doctors, our neurologists, that are more culturally aware of the community that we live in. Funding is only made available to city programs. And that's devastating to us because we cannot push forward what we want to do with our community with people that have been impacted by brain injury. And the funds that we do get are either donated or if we find a community grant that will allow us to build our sources here in Pueblo only lasts temporarily and then they disappear. Next slide, please. Examples of barrier to resources. Brain injury waiver in Colorado Medicaid program. It is designed to help you remain in your home and community after a brain injury. The problem is that the brain injury program has extra program rules to have, and it has a wait list. For example, the level of requirement, if you have to use the brain injury waiver, you have to need the long-term services that would be similar to being in a nursing home. The eligibility of a group 16 years or older, you must have a brain injury, and it has to occur before your 65th birthday. And the diagnosis has to be in this category that you're applying for. The other part is the financial requirements. If you are not less than $2,000, or if as a married couple, $3,000, then you have to decide what direction you take. Do you take the brain injury waiver or not? You know, and or do you just live on what you can do without losing all your assets? Next slide, please. What can you do to start? What can you do? Start with community knowledge. I think it's so important to understand who lives in the various rural communities of your state. You know, for Pueblo, we, you know, our rural setting is agricultural. We also have access to the Arkansas River that comes through the county, and we also have the whole aspect of our population of white people, Hispanic people, and a very small number of mixed population. And that, I think, is important to understand. How do we meet those that aren't the largest population? Take the time to learn where people access services. I think when we look at services, we have to know the agencies that are in our community. We need to understand how we can take those agencies and bring it upon the people that need those agencies and let them find whether those agencies will benefit them or not. Learn about the various providers in the community and what they offer makes them available locally. And so I'm very passionate about using our agencies that serve our substance use, our mental wellness, our all disabilities, people with disabilities that need housing, that need mental health services. Our opiate addiction here in Pueblo, Colorado is seriously very high. So I think it's important to know that these agencies exist and we need to use them. And the problem is that a lot of people don't even know they exist, including our hospitals and our other agencies that aren't aware that they have the ability to be accessed. Learn about the agencies and their resources. Invite providers and agency representatives to rural support groups or events to teach about how access services and to connect directly with those in need. It's important for me when I run a group that we have people that are from our rural areas and including Pueblo, that we bring in people from those agencies, the providers, you know, and they speak about what's available to the people in our communities. And I think if we bring them in, hopefully they'll learn more about who we are as individuals with brain injuries. Next slide, please. Train and educate. Providers need training on how to work with us. If we have an issue where, because brain injury sometimes does not reflect a disfigurement, we appear very normal, but our brain is damaged and it's been impacted. Then if the way we speak and our tone of voice or our lack of filters, people assume that we are aggressive people, and we're not. We're trying to process what's taken place in having a meeting with a doctor or a caseworker or who have you. Educate providers about what we need. We need to have access to resources. Our resources are very minimal and it doesn't reach out. The further you go out rurally, the less resources you will receive. People that live further out east, Pueblo, will have to take an ambulance in, or a family member needs to bring them into a hospital environment. Educate caseworkers, especially about brain injury waiver. When we have people that work as a caseworker within human services or social services, and they don't know that the brain injury waiver exists, then it puts us in a position where we don't have that access. You know, if we don't fit the brain injury waiver, what's the alternative for somebody who may have a brain injury as well as being blind and being an elder? Then maybe the brain injury waiver is not the format to go, and you may use the elderly, blind, and disabled waiver. We need caseworkers that are able to know what is going to meet that need of that individual. educate all providers about the lack of resources. And I discussed that somewhat, where we do need to let people know that these agencies provide resources, and if they're there, recommend, refer, etc. Train providers how to work with your community. I think that's the biggest thing that I have seen, is that providers need to come from, my hope is that if they are in our community, understand our community, and they become part of our community, come to our events, come to our fundraisers, be a speaker there, and so show the support and show that what's available for us in your agencies or in our hospitals. Train providers what is available in the community and where your community access the resources. And when the access to technology is increased, connect system portals for various programs so that we don't have to apply over and over again for various services. It would be so awesome to have one portal that you could just enter all your data into, and that person wouldn't have to continually repeat the cycle for every agency that they are involved in. It's overwhelming. It's hard to follow that, especially if you have cognitive issues. Next slide, please. Virtual survivors groups. I think it's the most accessible thing to have right now is the virtual platform. It's showing peer support, peers leading the projects that we offer. The community agency and providers presenting are there, and they're presented virtually. I'm a strong advocate for peer mentoring and in all communities. And I think we need to build the funding level for the rules communities at a much faster pace.
Thank you. That's a wonderful place to pause as we approach this panel, to have conversations and to share, right? To share experiences, lived experiences, and join together on some paths ahead. So Maria, thank you so much for that overview. Let's shift here now and let's talk, and we're going to hear from Terra Russell-Slavin to talk about inequities based on gender identity and sexual orientation. And then we're going to all come back to unpack some of those great points that have been highlighted around peer working together, around supports and making things more available, and really just having conversations about what information is available. Terra?
Thank you, and good afternoon, everyone. Again, my name's Terra Russell-Slavin. I'm Director of Policy and Community Building at the Los Angeles LGBT Center. Next slide. And Ellen already talked a lot of, kind of laid out language as a whole. So I'm just going to hit on a couple key points that I think we all already know, but just for the point of restating, which is that LGBTQ individuals are incredibly diverse, come from all racial, ethnic, and socioeconomic backgrounds. Language, that words that communities use to define themselves vary temporally, geographically, and culturally. I grew up in a small town in Texas, and the language used there was not necessarily the language used in Los Angeles. And the language we were using in Los Angeles 5 years ago is not necessarily, and actually is not a lot of the language we're using today. But what's most important is because many oppressed communities have had their right to self-identify taken away, using respectful language is one of the first important steps in becoming an ally. Next slide. So a little bit about the Los Angeles LGBT Center. For people who don't know, we were established nearly 52 years ago in 1969. We have 10 sites across LA, nearly 800 staff and 3,000 volunteers. And we provide more LGBT specific social services than any other organization in the country. We estimate about 50,000 client visits per month, and that's across a broad range of social and human services, which includes operating a federally qualified healthcare center that really started as an HIV/AIDS clinic back in the beginning of the pandemic. We provide mental health services. We've expanded now to transgender healthcare, senior healthcare, primary care. Our second largest program is our youth services, which includes operating more than 100 beds for emergency and transitional living programs for homeless LGBTQ youth. operating a drop-in center where we have more than 100 homeless youth come in every day, offer GED courses, food, job training, prep, mental health counseling, and sort of comprehensive social support. A senior services program, which is actually one of our fastest growing programs, and I think an area where we need to be doing a lot more when it comes to LGBTQ seniors. We also do survivor services for legal and mental health and cultural arts and so much more. Next slide. The real question is, why do we do this? And I think we've already been touching on this, but the reality is that LGBTQ communities across the board continue to face dramatic disparities and in just about almost every single area. Thinking about discrimination, we were really fortunate that the Supreme Court just last year finally ruled that Title VII protects people on the basis of sexual orientation and gender identity. And at the same time, we know that 1 in 10 LGBT people has faced employment discrimination just this last year. Lifetime prevalence is about 1 in 2. Isolation, and not just, and that goes from everything from covering or not being able to be one's true authentic self. And we see this particularly for LGBT seniors who are often forced to go back into the closet. And this has real consequences and real ramifications and leads to increased health disparities. Food insecurity, housing insecurity, and homelessness. I think we talk a lot about, just what a large percentage of homeless youth. We estimate almost 40% of all homeless youth are LGBTQ identified, but that just doesn't stop when someone ages out or turns 25. So we see that level of homelessness really expand across the lifespan and these increased levels. And in all of these categories, these numbers are more significant for trans as well as Black, Indigenous, and people of color communities who are intersectionally within the LGBT community. And I think since we're really talking about it too, we also see that with LGBTQ people who also live with disabilities. Economic insecurity. I think one study showed that nearly 94% of Black lesbians have faced significant economic consequences during the COVID crisis. Violence. I think there's a growing awareness about just the levels of violence the LGBTQ community faces, and in particular, I think a much needed attention on the, homicides of trans and non-binary communities. This year alone, there's been more than 37 homicides, disproportionately Black trans women. When we talk about data, we have finally a national, a large prevalent study from the National Crime Victimization Survey in 2017. It showed that 4 times as likely LGBTQ communities were as a whole to face violent victimization. Next slide. So what can we do? We can, funding. We not only have LGBTQ communities, we need have been historically left out of funding streams. We've talked a lot about data collection, and we've been having this conversation. I was even on a call before I joined this call this morning, that in almost 16 years, and my background, I started off before doing policy full-time as managing a legal project for survivors of domestic and sexual violence who were LGBTQ. And I don't think I've ever been in a space where a government agency has told me how many LGBTQ survivors they have served. There is just still a dearth of data collection. And I think that goes to sort of continuing to normalize not being out or making it uncomfortable. So how do we start to move people in that direction? And we need to make clear that discrimination will not be tolerated at all levels, and that includes increasing cultural competency within, between, and across federal agencies and federally assisted programs. Next slide. So, I wanted to give a quick think about a situation in terms of foster youth. And we work with foster youth who are in LA County. We estimate about 1 in 5 older foster youth are LGBTQ identified, which means they're disproportionately represented. And one of the stories we heard is of a transgender girl who was placed in an all boys group home and experienced harassment from other youth. Once she asked for assistance, she was blamed for the harassment. All of her feminine clothing were taken away. And then they also couldn't figure, they basically excluded her from outings because of gender segregation. And so what do we need to be doing to change this narrative? And I think it starts with, we need enumerated policies around sexual orientation and gender identity. We need cultural competency trainings, which includes ongoing training and technical assistance. And we have to start moving to LGBTQ specific services that both intervene early, right? And so try to avoid needing to take people, remove people, and then also find affirming placements. So I'm interested, I think that's all the time I have for now, but I'm interested in our group conversation. Thank you.
Thank you. And thank you. At this time, I'd like to welcome all of the wonderful presenters for a conversation. I have a few questions, and we also encourage questions to come in through the chat. I'm hearing lots of themes connecting really the calls to action that I'm hearing across all three presentations. So would love to bring us all back together and have a conversation on some of the things. If we can get Drayton, and there we go, and Maria down. The wonders of Zoom. First, thank you all so much for being a part of the conversation, for setting the stage, right? Like setting the table for us to engage on how we really think about direct service from an equity perspective or an equity lens. And so I want to just pick up on something I heard from all three of you and ask the first question. And again, if there are any questions that you would like to share for those of you who are joining in, please feel free to put that in the chat and we will get to it if we have time. But the first question, or the first idea, right? Like, we're talking about inequities, and we all seem to be in agreement and alignment that there are opportunities to think differently about the work that we do, how we make resources available, how we address barriers towards resources. But there's also this space, I think we've all shared a little bit, that there's differences of where people are and where they enter into this conversation around what is equity, how do I prioritize making sure that I'm addressing for some historical inequities. And so as we think about that, and we think about applying an equity lens to the work, my question is if we were to start with direct service providers and those who are working in programs, where should we be putting this professional learning or these workshops? Is that the priority when it comes to equity, or is it something different? So what should direct service providers know and be able to do in order to start implementing more of these great recommendations you have in this lens that you're providing?
I'll start, because for me, it's more of treat everybody differently, right? People have their own stories. And I think the word that we use in the poverty reduction, especially the steering committee, meet people where they're at. And I think that's what services have not done. And I mean, we're talking about all across the way. I mean, Tara just brought up something that's critical when we talk about adoption and we talk about foster care, right? Not adoption, but foster care. We don't hear about the LGBT youth in that. Like when they say it, they only say it with like, oh, the youth, period. But there is a difference, right? Some children don't get picked up because of the agenda. So, looking and meeting people where they're at. What is the help that you need? And I think that's something that services have not done. We know that with the Black community, it's mostly biased when you come in the door because of society norms, right? So as a Black man in this country, as soon as I walk in that door trying to ask for help, it's, oh, well, what are you not doing? So I did this, and I talk about this a lot. I walked into a DHS office with a suit one time and was literally told, because I didn't want that stigma that I didn't want to work or anything. And I was literally told that I don't look like I need services. So, we got to meet people where they're at. And I think if we can have a system, understand that everybody's going to come in differently and everybody's going to need a service in a different way, that will start to change a lot of how people are served.
That's really good. Thank you. So the meeting people where they are, I have a regional program manager in the Office of Head Start. And when he provides training for new people that join OHS. They go and they sit in a lobby at different agencies, and they watch how families are being interacted with, like to get a sense of what we don't want to do or what we want to do, depending on that. So I think that's powerful, meeting where they are. Other ideas about what training, what workshop for professional learning topics or things for direct service providers that are working in programs that anyone else would like to offer?
I would like to say that if, we need to have the community involved. You need to bring community into advisory boards. You need the lived experience of those that come from all avenues, not just the metropolitan or the inner cities, what have you. We need to bring rural people in. We need to bring all the people that are on today need to be part of it. It's, if we don't hear the voice of the people from the community, then we're living in an isolated world of providers, and that's very one way. And the other part of it is, let's develop some ways for translation, so people who do not speak the English language or they have a broken language, then there's translation available for them.
One thing
Thank
I
you.
would
Yes.
just add is I think we need service providers and people in roles of institutional authority to understand their power. And by that, I mean, I think about some of the conversations people have been sharing and just how hard it is, right? That like point where whether it's identity related, whether it is a disability, right? Like when you're being asked something and you don't, like, can you trust, right? Can you disclose? And what is the repercussions of that disclosure? And I have found, I think we sometimes underestimate that across the board, and just how much there's this gatekeeping that further penalizes or monitors people in a way that I think really disempowers the very communities we talk about wanting to empower.
That's powerful. I'm thinking of just the image of like when people are working together and it's completely available, allowable within the policy, but somehow it feels like they're doing you a favor or they're making an exception or but if it's available, I should be able to access it without so much of like showing up in the suit or the things that we, feel like people may have to do to get access. So I appreciate you lifting that up. Thank you all so much for that. Let's talk a little bit. Okay, so we talked about like workshops and training that we would say that we could fill in for those who may not be as far along in understanding the implications of their role and their work when it comes to equity and comes to dismantling some of the things that we're addressing. But what do we do while we're waiting for people to come along? I know it's tempting to try to solve, these challenges by putting policies in place or things that kind of put a barrier or block any perceived or real bias that our service providers may have. Are there areas in human service where it's best to leave it to the discretion of the direct service providers on how to respond and what other approaches might mitigate bias? So the question is, we know sometimes it's easier to say X%, like in Head Start, X% of children, there's a priority enrollment for children who may have disabilities, or there is categorical no questions asked for children who may be experiencing homelessness or in foster care. So we know that. So we have that guiding premise. But how do we go another layer to make sure across the various agencies that we're doing similar work without the piece? Are there other levers that we could pull regarding that?
So like one of the things that happened in Washington State was they have Terra kind of said it. You have to give up that power. It has to stop going to those that are delivering the services knowing it without us being at the table and having a conversation. What made the steering committee and Governor Jay Inslee's poverty reduction the 10-year plan that we did, it was the first time that a report was done with togetherness with people with lived experience and government officials and people sitting in those positions. So they had all the data and everything that they came to the table with. And when we read the first report, we were just saying, it's like, this is nothing of the truth at all. And once we started diving in together and understanding why this system did not work, we started to pull it apart together. So from our lived experience and their knowledge of maybe legislative thing, and let me say this too before I say that. Stop thinking that we don't know. That's the biggest thing too. You know what I'm saying? Because everything is like, oh, well, it's so difficult. You know, there's so much politics and yes, show us. And we did that in the steering committee is once they expanded, oh, well, this is why this doesn't work. And some federal things don't match with some state things. Now it gave us a way to have those true conversations. So the other part of it is constantly having those people at the table, constantly advising and giving the input to make the system what the system should be. Because you could sit there all day and say, oh, I've been doing this for 20 years. Yeah, has it changed? and that's the thing I think that with lived experience, no matter what you are with it, you have that experience, and that is the expertise that you can offer.
Terra?
Yeah, so
Thank you.
I agree with all that. And I think what I will say is I believe that there needs to be a level of discretion, but it's hard to have discretion when you still don't have a basic floor of rights. And so when thinking about specifically in the in the context of LGBTQ communities, I would like to see that like our policies or the practices, whether it's legislative, whether it's regulatory, right? Like those to me are the floor, and that we have to go above those, right? And so, but discretion, because I think we often, unfortunately, see people use discretion, and when there's not those floors of regulatory protections, then people face real harms. Right? Like we see real, regular, repeated acts of discrimination. And in a lot of cases, those people aren't even protected. And so I would say, how do we use that as a floor that you absolutely cannot go below this? And as a social service provider, you need to meet that floor. And then how do we allow discretion to meet where people are at and further serve?
Thank you. I appreciate that. I want to make sure we get time for Maria to get in on this one as well. Just you talked about how inequity challenges interacted with rural areas. What are some of the ways? And I mean, as we think about access, I in my mind, I heard you talk about access, and I almost saw like walls and fences put up blocking. So just want to hear from you just on that perspective of what do we do while we're bringing others along as well?
I think there's a lack of knowledge when it comes to rural. There's not a lot of data that supports rural, and especially when it comes to brain injury. But I feel very strongly that if the interventions have to be effective, they should be culturally relevant, including our rural culture as a priority. Exclusively, for the community voice and the persons that enter. Rural is different than urban. It's a different world. It's like going into a prison and you've never been in a prison and coming out. I really feel that we have to have more lived experience involved. And I think we have to have, we need caseworkers and people that work with us. It's hard for them to understand brain injury people. And because I think the problem is that because we don't look defective, it's hard for them to read us. And I think sometimes that we just have to allow ourselves to have our voice in there. And I think the language in policy has a big impact as well. The language sometimes doesn't fit. And some policies are so wordy, nobody wants to read them, so it works against us. So I hope that answered it.
That's very good. You said making sure that they're showing up in the conversations and spaces made for it. Drayton, you want to talk? So we talked a little bit about the rural side, but from you, let's talk geography just a little bit. And I welcome everybody to share on this question. But are there any compounding inequities that are faced in the racial, ethnic, or sexual orientation, gender identity spaces as we talk about where people are in our urban centers and our different areas?
So there's a study that Bookings did that really caught me when I think they went around about 4,200 or so white men and Black men. And the data that came out, because I got just that part of it because I remembered it, between 28 and 35 of the people that they surveyed, right? 54% of Black men still stayed in poverty after growing up in a home of poverty. And where their counterparts that were white, 29%, right? And Black women were 34%. So when you talk about, like, for me as a Black person, especially a Black man in this country, it's one of those things where no one knows that I'm trying, and that doesn't get highlighted. I kid you not, the first time I saw a Black man with his master's was in my 40s. So when we talk about how we are trying to address certain things, and I think both of my colleagues here said it right, there's policies that are made that if you really look at it, I sit on the Central Kitsap School Board district here, and the policy definitely has tones in it that allows teachers to do certain things to students. So, and that goes across the board with even government agencies and services, right? When that's what, as you start to see certain state funding that happens, does not coincide with federal funding. So instead, what we find is that there's policies inside of it that keep people trapped. So now I'm with a state fund trying to get services, trying to go to college, but because of this federal funding that the state gets, there's certain things I can't take a certain class that I want. I can't do, a certain program because it's about the money on the back end. So when we look at the differences, and especially for, I grew up in Brooklyn, New York, and now live in Washington State, right? Mm-hmm. Completely different on how the system is. Where in New York, it's getting you out, not getting you off, but hey, come in, get your service, get out. We're here, it's okay, let's take these steps. But then when you try to grow, as soon as the numbers change and your income or whatever it may be, it's back to square one. So it's like, hurry up. So I think, when we talk about it from Black and brown people, and Maria said it, especially our indigenous people, they don't even get the services. So we're lacking one cultural understanding, but what we're lacking is understanding how policies match up to get people out of services, but sustain them out of services.
Thank you. So powerful. I wish we had more time to really unpack and hear from you all. I guess I would just close by maybe inviting you to just give me one word, everybody, one big idea word that can really make an impact on putting the gas or the battery in these great ideas that you shared. And Terra, if we could start with you, and Drayton, we can end with you, and Maria can go in the middle.
I'm gonna go with
on the spot.
Yeah, no, innovation.
Innovation. Thank you.
I'm going to say wholeness and dignity.
Drayton?
Now.
We
cannot wait no more. This is the time to change the system. So now.
Effective immediately. Absolutely. Guys, thank y'all so much. And being in the space on Zoom with you has been wonderful. Learned a lot. And I'm hopeful that whatever questions, if there were any, that we get a chance to have them and look at them as we make great decisions. hearing from you, doing it in partnership. And I really, really, truly thank you all so much for coming, showing up with your own stories. And I know that is changing hearts. The data and the information is a package, right? The story, the information, and then the call to action. So I thank you all so much for letting us know that we need to innovate and focus on wholeness and do it now. And with that, we thank you for being a part of today's conversation. Thank you all.